Good morning, all of you. My name is Chand Praveen Nandu. I am from Jalna. I recently passed out my Bachelor of Pharmacy in Dr. Babasaheb Ambedkar Technological University, Lower Raigad. My today's topic is technical, and today's subject name is medical coding, and topic name is modifier in medical coding. So we are start a detailed explanation modifiers in medical coding. We are in the medical coding are two-digit codes added a primary or procedure services code. Provide additional information about services provided. They help to clarify the circumstances under which the procedure services perform and the allow for more accurate billing, ensuring that the correct reimbursement. Provide the modifier are used primarily with the current procedure terminology CPT codes as well as the healthcare common procedure coding system SCPCS the codes. Important of modifier clarification. Clarification is the most important in modifier. The modifier are the provide important detail in the explain of the procedure or the services was altered or the different from of the usual. Then reimbursement by the accurately reporting the modifier, the healthcare provider can ensure that they receive proper compensation services provided. Then avoiding a fraud. A correct use of modifier is help avoid over under reporting services, which can prevent maintain compliance with the healthcare regulation. Then medical necessity. They help the support claim procedure or services that are modifier necessary, but they are not typically reimbursed under the normal circumstances. Types of modifier. The modifier are categorized in two main types. CPT modifier level 1. These modifiers are used to provide additional information about the procedure. Explain example modifier 25. The significant separately identifiable evolution about the evolution management services by the same physician and the same try of the procedure. Then modify 50. The bilateral procedure perform the both side of the body. Modify 59. Distinct procedure service indicate that the provises services distinct independent from the other services performed on the same day. Then SCPCS modifier level 2. These are the often used services supply equipment including non-physician services such as ambulance, rides and durable medical equipment. Example modifier KX, modifier GA. The KX is your durable medical equipment to indicate that services meet specified coverage and criteria. Then modifier GA, the waiver the liability excitement of on file provide except patient on financially responsible for non-covered services. Commonly used modifier medical coding. The modifier 25 is significant and separately identify evolution management services. This modifier use the evolution management services is provided same day on other procedure services. It indicate the healthcare. It indicate that the evolution management separate and significant throughout the reported along with the procedure and merely part of the normal representative prospective care. Example a patient visit of minor surgical procedure but also require evolution management services medical issues such as examination for a cough. Then modifier 50. Modifier 50 is a bilateral procedure. This modifier used when the same procedure is performed in both sides the body. The applies when the procedure inherently bilateral, meaning it is the typically done or both side. Example. The example of bilateral knee is replacement would use this modifier to indicate that both knee were the operated during the same season. Then modify 59. The distinct procedure services. Modify 59 indicate the procedure or services distinct separate from the procedure performed on the same day. It often the used to report multiple services that are unrelated and not part of the same procedures and package. Then modify 22. Modify 22 is increase procedure services. This modify used when the services is procedural has been significantly increased. Extend the beyond the usual required work. It is applied with when the complexity, difficulty, or required for the procedures greater than what is typically required. Then modify 33, the preventive services. The modifier is 33 is used to identify services related preventive care defined by the Affordable Care Act. It applies the services provided with the inpatient prevent future health issue. Then modifier 76. The modifier 76 is repeat procedure or services by the same physician. The modifier 76 is used services repeated by the same physician or other qualified healthcare professional. Then modifier 91, 51 also present. Then accuracy using a modifier incorrectly can lead to defined claim and overpayment or the fraud allegation. So thank you watching for my video.